Hi, my name is Ayomide. Welcome to the World Without People podcast, where we journey into some pretty amazing stories of everyday people. I believe strongly in the interconnectedness of our human experience, that we can color and enrich our lives by sharing and learning from our lived experiences. In this concise podcast, I bring to you engaging conversations like a chapter in a vibrant book, designed to motivate and encourage and challenge and, of course, brighten your day. My guests also get to ask me one question, and there's no telling what they might come up with. So thank you for tuning in. Grab your coffee or tea or listen on the go to some amazing stories of real people. After all, what is a world without people? Welcome, everybody, to another episode of The World Without People. My name is Ayomide, and I'm so excited for you to be here today. I can't wait to introduce my guest or have this conversation with my guest, Dr. Olayi Oyekanmi, Olayi for short, that's what they call you, who is a doctor of physical therapy as well as a professor. So we're going to be talking some brainy stuff today. No, I kid. But really, I really want to know a little bit more about your journey, understand what it is that you do, because I have never met a physical therapist, and so this is kind of cool, and just really get into some understanding about the human body and all that interesting stuff. But before we do any of that, tell me about your most gruesome injury.
We're starting out, we're hitting out the gates heavy. Let's see. Funny enough, one of the most gruesome injuries that I've treated was not something that happened right away. It was somebody that I treated who had a car accident years, maybe 20, 30 years in the past, but was still suffering from it. He was an avid motorcyclist, he rode motorcycles. And he T-boned the car and ended up flying, broke his leg, ended up having surgery on his leg maybe like 10, 15 times, I believe. And this surgery, or the pain from the surgery, the disability from the surgery, carried on with him up until his, I want to say like mid to late 70s. Around the time when I was working with him, I want to say maybe like 3 months. He passed shortly after that from different things, but it was something that stuck with him for a while, which is unfortunate and tough to see him try to fight it during the time I was with him.
Yeah, no, that's crazy. Which actually, funny enough, I had a question about that. So, for example, I always think I'm going to do this daredevil thing in the future. Like I'm going to be like a biker girl, or I'm going to be like bungee jumping and things like that. So in the future, I think that, I'm psyching myself up to it. Skydiving, these are things that look so cool. Would you tell people to do this?
You're a better person than me. Look, the way I see it, my preferences are different from other people's preferences. I recognize people are daredevils. I am not. I tell people, you cannot pay me to jump out of a plane. Absolutely not. Like my feet have to be on top ground. That's it. But I think people should explore things that attract them. If it's jumping out of a plane, if it's scuba diving, I don't know if it's too soon to say go looking at the Titanic. Might be, but yeah. Life is life. You have to enjoy life whichever way you can.
Right. And I do feel like your profession, though, is like you're seeing these things every day. Like I remember, I forget his name now, but he's an older guy, 70 years old. He used to be on one of my favorite shows, and I'm blanking on his name. And I was like, he died on with a motorcycle, I don't know, whatever the English. Motorcycle accident. And I was just like, the hell? Like, first of all, you're 70. Like, you should not be doing this. And two, it just feels like such a waste of life, Like, I feel like he had the time and it's a conscious effort. So I wonder if your profession, like, you're a lot more cautious because of it, or no? Do you feel like that's your personality?
Yeah, I think my cautiousness has more to do with my personality than anything else. I'm all for entertainment. I'm all for, like, being on the wild side, low key. But like I said, jumping out of planes, that's a no-go, bruh.
Okay, I love it. All right, let's go back to the beginning because I want to start with some things fun and easy for you to kind of make you, feel comfortable. But I guess walk me through the journey of becoming a physical therapist, because I always think that this is not like a field that people would do without their own kind of like personal experience, or they knew someone or something like that. So why PT?
Yeah, all right. So you're right with that. Honestly, I want to say maybe like 80% of physical therapists have had some experience with physical therapy, and that's how they end up gravitating towards that field. For me, my story was a little different where, this goes back to high school for me, where I had no idea what I wanted to do. My grades in high school were terrible. Like I purposely threatened to send me to Nigeria a couple of times because of my high school grades, but it was what it was. But where I grew up, everybody has to take a class called careers and civics. And the careers portion of that class exposes you to different types of professions. And there's a particular, whether you call it a survey or whatever, that takes into account your strengths, your weaknesses, your likes, your dislikes. Basically, how you answer the questions populate a bunch of professions that may be suitable for you. So one of the top ones for me was physical therapy, which I had some experience with, but not enough to have an opinion on it. So going towards the end of high school, I took a course. There's a kinesiology class, an exercise science class. And that was probably my best grade in high school, which honestly is not saying much, but it is what it is. And that kind of sparked the journey of applying to university and trying to put myself on a path to getting towards physical therapy. Luckily enough, things kind of stuck. Each stage I got to after that, my grades got a little better. So ended up in university, graduated, ended up in PT school, ended up being very successful there. And the rest is history. Now I'm in the field working. I've been practicing for about almost 7 years now and still loving every bit of it.
And that's a good question. Well, you didn't plug the fellowships and the awards, but okay, that's fine. We'll talk about that later. But that was something I was curious about. Has there ever been any point in this journey where you're like, maybe this is not for me, or maybe like you've now started to find other passions and things where you're like, okay, maybe I need to start exploring that?
I think the point in life where I was kind of skeptical about physical therapy was before I actually got into physical therapy school. So, some struggles with particular courses in college, like physics, for example, like up till today, physics is the bane of my existence. And I actually tried to change my major once because I was like, oh my, I have to maneuver my way around this part. But I think that aspect
Right.
and then the process of applying to physical therapy school was kind of hectic. So I started second guessing myself at that point. But luckily, I always have Bumsy in my corner. She pushed me to kind of keep at it. And I'm happy she did because I followed through. I ended up where I ended up.
Good.
I ended up at a school that, honestly, in my opinion, provided me with everything I needed to be successful in my profession. So from the point I hit PT school, it was straight on from there. There's no looking back. It also cost a lot of money.
That makes sense. And you did it in UPenn, right?
Nah, so my undergrad was at Penn State, big difference. But my PT school was at New York University.
Okay, all right. And so now you're doing this career and, walk us through, like, I guess the beginnings of it, because there's one thing from the know-how, like all the knowledge you gain in school, and then translating that into like the actual day-to-day working with, actual physical therapy patients. So talk us through that.
Yeah, so I mean, in school, everything is pretty much by the book, you could say, right? It's all these typical conditions, and if you see A, it's followed by B, C, and D kind of thing. So when you prepare that way, you study for exams that way, you expect to see that when you get into practice. And honestly, I can count the amount of times of one hand that I've seen things that present exactly the way it shows in the textbook. So in real life, there's a lot of curveballs that are thrown, but the amount that you see opens you up to like different possibilities of a different presentation, and you learn how to deal with it that way. So where they say experience is the best teacher, honestly, that's exactly how it plays out with physical therapy.
Right. And I know you had mentioned when we had talked earlier that active mentorship was part of like one of the great things about like your first job. So talk to us a little bit about that. And I guess the part two of that is I often think that as an introvert, I would not do well with people. So again, in school, you're dealing with books. Now you're dealing with actual human beings and their personalities and all of that. So just kind of talk us through how kind of both of that was, helpful or new or different for you.
All right. Well, on the mentorship aspect, one of the things about PT school is you have to do clinical rotations in order to graduate. right? So for my school, for example, we spent 6 to 8 weeks in a clinic learning from somebody. So that was active mentorship during school, right? So you're still learning kind of thing. Getting into the field, I was blessed enough to work with a company who made it a point to continue that mentorship for what was supposed to be a year, but ended up being much longer than that, which was very helpful. I was always working with my boss at the time. And if I ever had to run things by him or, practice things while we had downtime, he would always have his eye on me. So if he saw something that I wasn't doing right or I could do better, he'd call me over and we'd chat about it real quick. So there's always like in-game mentorship, which is always very helpful. And with him, he just happens to be like a really dedicated person where we could have calls at 9 o'clock Saturday morning if we needed to talk about things. So that was something that was very helpful for me as far as, developing my skill set and being able to grow. And that's something that personally I cherish, and it's something that I try to pass on to younger clinicians now. As far as the personality aspect of things, physical, it's one of those professions where you're dealing with people on a daily basis. Now, a lot of professions also do that, but here it's, not to say that it's any different from any other profession, but I'm dealing with a particular person for 1 hour, anywhere from 1 to 3 times a week. So you get to learn a lot about people and how they think, their thought processes, things like that. And that therapist aspect of physical therapy is real. Like you come to hear people's stories. I've heard people's war stories. I've heard stories about people catching their wives cheating, it's ridiculous the amount of things you hear, but it's one of the things I love about it. And it's one of the things that can be frustrating because on the other side of it, you have people who are not like the nicest human beings, right? But you still have to be professional. You still, like, my goal is still to help you feel better, help you achieve your goals. And I can't let, how you treat me or other people around necessarily affect that. Now, don't get me wrong. There's a line that has to be drawn when it comes to patients being disrespectful. But if you're just quote unquote not a nice person, like, I got to take that on the chin, So that part can be tough sometimes, but you learn to deal with it and you learn how to kind of maneuver around those people, but still get your job done.
Yeah, but there's also the pain of it, right? Like, I cannot imagine being in constant chronic pain or even acute pain, whatever, and and going through that. And again, I don't know the day-to-day of physical therapy, but like, I can imagine like the pain and then needing to lash out. And so how do you deal with that? Because, it's being able to separate even the fact that this person may be a good person or a nice person, but like they're lashing out because of the pain. And I'm assuming that they teach you that in school, like part of that emotional and counseling and all of that intelligence as well. But, okay. So I'm seeing your face. You're saying no?
It's not something that's touched on heavily, right? They make you aware of it, right? As human beings, we all recognize that if, just from everyday life, if somebody's in a bad mood, they're likely to say something that they don't mean, right? Being in constant pain can put certain people in a really bad mood. So just as a human being, just like that, you have to understand that is a possibility, right? So you can't really judge people from the beginning based on, how they're acting. You take into consideration the fact that they are in pain. But it's also, to me, that personality component is very different from, like your character trait, if that makes sense, right? You can be a very nice person, a very pleasant person, but pain is making you grumpy, and that's okay, right? I understand that, and that's actually something that I used to get a good understanding of how somebody is progressing, right? I get that grumpy patient, and 3 weeks later they're in the clinic cracking jokes. I'm like, well, you're not the same person that came in 3 weeks ago. And I'll bring that up to patients, and especially those people with chronic pain. When they look back, it helps them kind of process, oh, things have changed. Like, where I wasn't smiling, I wasn't joking before, I'm doing that now. And sometimes they need that kind of like switch to flip for them to recognize that they are doing better and help motivate them to continue doing better. So that's actually a very good question.
Thank you. All right. So tell me about a setback throughout this journey that has maybe turned into a blessing. You learned some things from.
Let's see. All right. So, your listeners, viewers don't know this, but I'm not an American citizen. I was born in Nigeria, moved to Canada when I was younger. So I am a Canadian citizen. And I came to America for university, for college, undergrad, and grad school. One of the things I was trying to figure out while in PT school was whether I was going to stay in America and try to get, a work visa, or if I was going to go back to Canada or go back to Nigeria. I was lucky enough to get a job that was willing to sponsor me for my work visa. And throughout that process, I realized that physical therapy is one of those professions that you can actually just jump straight to green card applications without, all the extra steps, which I thought was a blessing, and I was very much looking forward to because it would make things easier. At that point, if I'd gone back to Canada, I'd have to take my boards all over again, and I mean at the time I wasn't planning on doing any more studying. But anyways, went through the process, hired a lawyer, put all the paperwork in, and every time a piece of mail comes through from the immigration services, I get excited. All right, we're closer, we're closer, we're closer. I opened up a piece of mail one day looking for the date for my interview, and I see no date. I'm like, where's the date? So now I start reading properly, and I'm seeing all these legal jargons, but whatever. The part that I zoned in on was like, you have 180 days to leave the country. Woo! Mind you, I was in the middle of work when this happened. So that was talk about a setback. So I had to decide, obviously, when. It wasn't a matter of if, it was when I was going to leave. So I went back to Canada, and from there started having a lot of different thought processes. Was I going to just stay in Canada? Was I going to go back to Nigeria? Was I going to try to figure something out to come back to America? I decided to at least to try to get back to the States just because it would have been, that was where everything was already set up. At this point, this was in 2018. I'd been living in the States for 10 years at this point. So it kind of was like my main, at least where I called home. I had to look for new lawyers, go through the whole process again. And now it was like, with the original thing happening, it was always something in the back of my mind. So it made things very difficult mentally, just now not knowing what was for certain. So there was all these things in the air, and it made it difficult to focus on work itself and even just my personal life. But thankfully, things ended up working out, ended up getting my interview, the actual interview, and ended up getting a piece of mail that said everything was good and I should expect my green card in the mail. Fun fact though, the green card got accepted the day before 45 put the travel ban on Nigeria, where Nigerians couldn't get immigration visas to America. Okay. My paperwork got signed off on the day before that. So we almost entered Wahala again.
Awesome. And I remember you saying that, that was a period you also got to like study for another exam, so you had time to do things like maybe you wouldn't have been able to do. So tell me about that.
Yeah, so that's a fair point. Prior to, getting the news that I had to leave, I had registered to take an exam that would put me in kind of like a different level of physical therapist, where I would be a certified specialist in orthopedic physical therapy. And the time period where I had to leave, I had nothing to do. So I was literally just on my mom's couch studying. So where studying might have been a little more difficult with work and, other responsibilities in New York, at this point I had no responsibility. So it was literally study. And I got back to the States just in time to take the exam. And luckily I was able to successfully pass and get into this new stage where I had new knowledge and new opportunities because of that certification.
That's awesome. And if you look at Olayi's LinkedIn posts or like Instagram, you see all the many different, what they call them? Certifications, I guess?
Yeah. Some of them, one of them just says I'm a licensed physical therapist. Another one says I have my doctorate. Another one says I'm a board certified specialist. There's one that I used to have where I was a strength and conditioning specialist, but I actually ended up letting that one lapse because I wasn't really using it. Didn't see the need to keep updating it. And then there's one more in the works. One more coming soon, which would put me at the top of the chain as far as physical therapy is concerned. So looking forward to completing that journey soon.
Okay, so I just want y'all to get this picture. I didn't just mean to make you recount things. I'm trying to paint a picture here. You go from somebody who you're saying in high school, you didn't even know what you want to do. You're being chosen by your dad to go back to Nigeria. And then here you are a couple years later with all of this. And one, I think it's very, very hopeful for people to just kind of believe in themselves, know that they got this. Two, obviously take a career assessment and take it early. And hey, late. It's never too late to take one, even if you're older. But I think 3 for me is that you're basically identifying that PT is multifaceted. And, obviously in my mind, PT is just PT. So tell us a little bit about the different aspects of PT that you guys do.
So for the most part, when people think of physical therapy, they think of what I do, which is working in a clinic, treating people for knee pain, back pain, neck pain, or somebody that's had surgery or been in a car accident. The other aspect of PT people think about are the PTs they see on the, on the football field, on the basketball court when somebody gets injured and these guys run out and try to take care of them. What people don't know is that, at least the majority of people don't know, is that there's pediatric physical therapists that work with babies. I'm talking about like newborn babies in the neonatal ICU, or preschool babies who have developmental delays like cerebral palsy or on the spectrum, things like that. There are geriatric physical therapists who specifically work with the older population. There are cardiopulmonary physical therapists who work with people who have things like COPD, chronic obstructive pulmonary disease. There are neurologic PTs who work with people who've had strokes, who've had spinal cord injury. So when people talk about, I had to learn how to walk again because of the severity of a car accident that damaged their spinal cord, those are the PTs they work with. There are PTs that work with pelvic floor patients. So people who have incontinence, people who have like pain with sex, things like that. So a lot of people think those things can be normal. They're not. And there are people that you can see to help with those things. Let's see, I'm sure I'm missing some, but there are a lot of avenues to go as far as being a clinician when it comes to physical therapy.
Okay, that's helpful to know because, again, I wouldn't have thought about that. But I guess let me go back. How do I then prevent ever needing to see you?
See, if I gave you that answer, I'd be out of a job. I can't do that. Like, I'm joking.
I'm sure you have enough clients.
Trying to stay busy. What I do tell people, though, ultimately is remaining physically active is your best way of avoiding injury. Now, I mean, we have to take into account that things happen, right? Like you can be walking down the street and roll your ankle and need PT and you weren't doing anything that was, out of the ordinary. So injuries they're an aspect of life. But typically the more fit you are or the healthier you are, and that's not just physically fit, it's also mentally fit, things like that, the better position you put your body in to withstand injuries or for your body to be more resilient. So if you do injure yourself, you bounce back pretty quickly, right? Like I think of like being in high school playing basketball, rolled my ankle swole up. 2 days later, I was back playing basketball again. But at that point, you're young, you're healthy, your body recovers quickly. In the older ages, things don't happen that way quite as easily. But the more you take care of your body, the less likely you are to be in a situation where you do need to look for help, I guess. But on the other end of that, I think if you do end up in a situation where you need to find a physical therapist or a healthcare provider, the earlier you do it, the better. And I say that specifically because injuries that aren't treated can turn into chronic conditions. And when they become chronic, it goes beyond just a body thing. Your nervous system, your brain gets involved and things kind of stick around. Even though the damage is no longer there, your body still, or your brain still perceives that threat. So if you come to see me 5 years after a particular injury, at that point, I'm not just treating said injury. I'm also trying to to put it simply, rewire your nervous system to understand that there's no longer a threat to this body part and things are okay to do. So it becomes a little harder at that point. It's not impossible, but it becomes harder and the rates of success become lower in those situations.
Okay. And would you say that an ankle injury, like you just described, is one of the most common injuries you see, or what is the most common one you see?
I mean, personally, it depends on the season, right? So if I take New York, for example, when I was working in New York during the winter months, you would see a lot of people who had like muscle tears or, fractures because they had slipped and fallen, because of snow and ice and things like that. And then in the summer months or spring months, you would see more tendonitis type situations because, people have been indoors all winter. Now they want to go play pickleball or play tennis or and they end up overusing muscles that they haven't used in, a good amount of time, and things start to flare up. So the season definitely plays a role in what becomes more common. Also, the setting that you work in plays a role. So there's some clinics where they exclusively focus on, vertigo or balance patients, and that's typically what they'll see. My clinic currently is what's called a general practitioner kind of clinic. But I would say currently, the most common thing I'm seeing is people who've had knee replacements, which is quite, I don't want to say a simple thing to deal with, but fairly common.
Okay, that's fair. Okay, so PT also, I'm guessing like you have to deal with the physical, but I assume that you also have to deal with a lot of other external factors. So for example, everything from, say for example, the person is obese, right? And so then the person maybe has to be doing, some work on their diet, or, just needs mental health therapy as well, right? Because I can imagine if you've been in an accident or whatever, you need that kind of support to kind of help you. How do you talk to each other? Because I feel like PT is outside of that, traditional medical system where everybody's there kind of like at the same time. So how do you guys do that?
Yeah, so there's certain fields where that is much easier to do. So typically people who work in a hospital setting, they have direct access to a lot of the other healthcare providers, be it mental health, be it their physician. When people work in a school setting, they usually have all that information. In the outpatient setting, it's not readily available, so you have to make that active effort to do so. So I'll say with my patients, when I go through my evaluation, I usually ask about their past medical history, and I'll get anything from, autoimmune disorders to history of cancer or active cancer, which has happened, or pulmonary issues, cardiovascular issues, mental health issues. So I'm aware of it at the beginning. And I personally won't reach out unless there's something that appears to affect what I'm trying to do, right? And I mean that I guess it could be positive or negative. But for example, I had a patient recently who got into a car accident, and she had mentioned her anxiety went through the roof after the accident. Like, she couldn't sit in a car for more than 10 minutes because of, we'll call it the PTSD that she sustained from this car accident. And that was somebody who it was important to reach out to whatever mental health provider that they were working with. Actually, with her at the time, she wasn't speaking to anybody. So it was something that I recommended, which triggered her to reach out to somebody that she had worked with in the past. So that communication is there and can be there. It just has to be actively pursued in an outpatient setting. In other cases, there are things that I can do to address it. Now, by no means am I a mental health provider, but there are things within the scope of physical therapy that can be addressed to deal with some level of anxiety, some level of depression, especially when it contributes to their symptoms. I say that because what we call affective or cognitive disorders, so depression, anxiety, what we call pain catastrophizing, like somebody thinking their back is going to crumble because of their back pain. There are ways that we can address things to allow that person to quote unquote normalize, for these things to have less of an effect on their symptoms so they can get back to their daily activities. But if it does go beyond a certain point, like there's only so much I can do. And what's the word? It would behoove me to reach out to the appropriate healthcare provider. Meantime, I'm trying to use big words.
I love it. Okay, so that sounded very positive. So I guess maybe the flip side of that is the negative, which when I think about alternative medicine, I know there's been some back and forth about it from the scientific, folks. So, like things like cupping, even like, I guess the chiropractor is considered alternative medicine, acupuncture, those kind of things. Have you ever, I guess, experienced it where it's kind of like done damage to the work that you're already doing? And is alternative medicine something that, from your perspective, you don't see what the issue is with the scientific folks?
So I'll put it like this. I think alternative medicine can definitely be used as an adjunct to physical therapy. There are a lot of aspects of alternative medicine that have been brought over to physical therapy. Now, the thought process behind it may be different. So you take acupuncture, for example. Acupuncture is Eastern medicine that focuses on energy and chi with the use of needles. In physical therapy, we have dry needling, which is essentially the same thing, except our thought process is we're, decreasing tension in muscles and allowing them to do their jobs better than they are with whatever tension is present, right? So if somebody gets acupuncture, they're essentially getting dry needling. It's just how it's verbalized to them is a little different, but it can be helpful, right? Cupping is something that we also do in physical therapy. Again, I don't think I'm moving around energies. I'm using it to bring blood flow to the area, decrease muscle tension, and allow the body to move more freely. What chiropractors do as far as the adjustment, physical therapists do as well, right? So those two things can coincide. Now, I will say that there have been situations where, and this is not particularly a knock on any of the professions, it's more person dependent, right? Where a person was getting physical therapy and chiropractic at the same time, and they'd walk out of the physical therapy clinic feeling great, come back and like, oh yeah, I felt great. But then, I saw this other provider and my pain is worse now, right? I don't think chiropractic is bad. Hell, I like adjustments. I do it all the time. I have it done on me. But with this particular patient, that aspect of treatment was not beneficial for them. So that was where a conversation needed to be had with the patient and also with the chiropractor to figure out, what was happening. Because sometimes patients do miscommunicate, right? It may not have been that he was at the chiropractor and then felt worse afterwards. It could have been, hey, I went to the chiropractor and then I went to go run, 5 miles, right? So having a conversation with that chiropractor can help put things into perspective as well as to, is it what we're doing or is it something else? And then that communication happens with all parties and we figure out what the best avenue is.
Okay. And since even though we call it alternative medicine, it would be said that it's probably been around before PT, for example. Would you say that you guys are incorporating Eastern medicine into your field than the other way around? So again, the examples you just used of dry needling and cupping.
Honestly, I don't know the research on that, so I don't want to quote it, and I don't want any physical therapist coming for me. So I can't give you a definitive answer on that, but I do know we do take those concepts, but use it from a research-based perspective that focuses specifically on the muscles and the tissues that we're working on as opposed to, the other things that are being looked at with these other practices.
Okay. All right. That's fair. So, okay. I don't know if you've seen the story of the guy, in the Netherlands who was able to walk due to the electrode implant. And obviously with the advancement of AI, I don't think they're taking your jobs, but where do you see technology kind of helping people in your field?
That's a good question. A lot of where I've seen technology come into play with physical therapy is more in the neurologic field. So working with paralysis and things like that, where, they can use electrodes kind of wired to the brain in a way where your thoughts get the fingers of a prosthesis to move or something like that. I don't see it as much in the orthopedic setting besides, different instruments like the Theragun and things like that. But I think there definitely is a place for technology in physical therapy. There's a place for technology in a lot of things. But as far as AI, I don't know. I'm just trying to keep my job though.
Okay. And then I guess the flip side of that is also things like, marijuana and the medical marijuana in helping alleviate pain. So again, in my mind, sometimes it kind of is like a placebo effect. And I wonder if that is the case, but also if it doesn't even make people get the kind of PT that they need or the appropriate PT that they need, right? Because they're basically, what's the word? Stemming basically that pain. What's the word I'm looking for? So basically, if you think about it, right, pain can sometimes also be that trigger for you to actually do something about something. But if you're stemming it and you're using, weed or whatever all of the time, or even to replace that, then you might not get help that could actually stop you from needing to do that. So, how do you advise patients who come to you and say that's what they do or that's what they want?
Yeah, so very few patients I've had that use medical marijuana for pain relief, but I'll talk about just regular medication the same way, right? So pretty much what you're saying, medication is a tool that's used to mask pain, right? And if you can't feel the pain, you keep doing what you're doing, whether or not it's that activity that's causing your pain to increase. So if somebody comes to me and they're in a lot of pain and they're using pain meds, I don't think that's a bad thing. Because if you're in that much pain and you need the pain medication, by all means, put yourself at some level of peace. But the hope is that we can get you to a point where you don't have to rely on the medication as much and then we can dive down to the root cause and try to address the issue, right? Because without the issue being addressed, that pain is going to be there. And if it's not there consistently, things are going to trigger it again and again if it's not handled through treatment, right?
Right.
I think there's something to be said for kind of like placebo, like you're saying as well. There is a lot of research about, I mean, obviously, when they do a lot of research, look at randomized control trials, you know this, Madam PhD, right? You have control studies. And there are often times where they have an intervention arm and a control arm. And you'll find that, the intervention arm, yes, it gives better results. You have better outcomes. But the control arm that had no actual treatment also does improve, right? So what does that mean? Sometimes it could be that just the thought process that you're having this treatment done, even though it's nothing, puts you in a state of mind where you can actually heal yourself as well. So, I mean, that's a whole nother conversation as well. But I think there is some benefit to that. But ultimately, the goal is to decrease people's reliance on medication, primarily because there are side effects that come with medication, right? Anti-inflammatories that people take, like regular ibuprofen, can have side effects to your stomach, right? Which is not ideal. And then obviously most people are aware of the opioid epidemic where, people are being prescribed like oxycodone, Percocets, and they become addicted to them. So physical therapy is a way to get people out of pain so they don't have to deal with the repercussions of being addicted to pain medication.
Thank you. That was excellent. Okay. Well, you just said you can heal yourself. So I guess the question is, are you physician heal thyself? Like, are you one of those people who are, you're really bad with going to see doctors and things like that? And I guess the additional part to that is like, this is also a very physically demanding profession. So how do you prioritize self-care and avoid burnout while, providing care for your patients?
Yeah, that's a good question. It's funny, 7 years into practice now, and it's now that I'm really trying to make an active effort to do that. I've had times where I felt like I was burning out, but never to the stage where I actually got to that point where I was like, I'm done. And some of that was self-inflicted, to be honest, because I found myself like doing everything I could to get better at my job. So there was a lot of time in work spent working, time outside of work spent trying to learn new things, but then also trying to maintain like a solid social life, right? So there was a lot of, there was very little time for rest, let's say that. So even now, like going through my fellowship program, I'm at work, I come home, I do more work, but now I'm like, all right, this is like sit home time. If it's just to sit down and watch a movie or Netflix or, something like that where I can get my body to unwind and kind of reset from all the, we'll call them stressors that have been going on. So my mind it's never too late, right? So 7 years in, I'm just starting to work on that. And I'm happy about that, to be honest. I'm happy about that.
That's good. That's good. I mean, because like I said, just thinking about how physically demanding it is. I went for my first chiropractor visit. It's probably my last because I didn't really need it, but I was curious a couple days ago. And I'm like, this is a lot. Like just having to deal with people, touching people, all of that just seems like a lot. So kudos to all of you who do this amazing work. And I have one last question for you that is not related to PT. So you have mentioned now Canada, Nigeria, New York, and you didn't mention where you are now, but I'm going to tell the people. So you're in Atlanta now. And one thing I've done before in another previous episode was just kind of find out, okay, what's your experience? And I'm going to first of all ask this as a single person, if you are single or just even dating, what is the difference in location for you? Like, how does that play out? Because I do feel like, especially within the Nigerian community, we have different ideas of the kinds of Nigerians that are in different places. So tell me a little bit about that.
Let's see. I mean, when I was in New York, I feel like people are forced to interact with each other a lot more in New York just because space. Right. I found in New York, it was much easier to talk to people while I was out than I do here. But I also find in New York, everybody's on the move. So I mean, I personally don't think dating was the easiest thing to do in New York. I found myself dating before I left New York. I actually was in a relationship that kind of fizzled out shortly after I ended up in Atlanta, unrelated to distance. But I mean, it's definitely possible. I think there are things that make it possible and things that make it difficult as far as New York is concerned.
You mean in
Atlanta,
New York?
In New York specifically, okay. Yeah. In Atlanta, I mean, it's hard to say in Atlanta because I'm trying to compare almost 10 years of living in New York to 9 months of being in Atlanta. So it's hard. I don't know. It's hard to kind of conceptualize, but I feel like out here, I spend most of my time in my car, right? So there's not that much interaction, like say like taking the subway and things like that, or like walking down the street, because it's not a walking city by any means, unless maybe you're downtown or, in certain areas that are built for walking. The social life in Atlanta is just as vast as it is in New York. And maybe it's just me being in a different place, but I don't know. I don't find it as easy to talk to people as it was in New York. But that could also just be a me thing. I don't know.
It's fair. I think that's a very good appreciation of the difference. The last person I was talking to, I was trying to, US versus Nigeria and, the kind of people and stuff like that. It was kind of interesting to hear, at least from a female's perspective. So thank you for giving us from a male's perspective, even though you didn't kind of really go into it, but I'm going to let you go. At least you gave me enough to be able to say, people, if you need his number, I have it. So just in case, I know you can't see him, but you'll see the flyer. So I'm going to be, your PR person for that. All right. Well, with that said, you get to ask me one question.
All right. If money was not a concern and everywhere you travel to is off the list, what would be your first travel destination? And what about that particular area draws you to it?
That's a really good question. And I feel like somebody may have asked me something similar. And I likely said Nigeria at the time because, there's just something about Nigeria for me and home. But I think that now that I think about it again, it'll be somewhere with water. So Maui, Bali, Hawaii, all the E's, just somewhere with water. Water really calms me down. And so anywhere that I can see water for days and days and days is where I will likely go to. And I was talking to my cousin the other day. It's like, okay, 40s is quickly approaching. And so that's the kind of trip that you want to do, first class, all expenses paid kind of thing. You're staying in a solid hotel, just one of the best. So that's something that I'm going to start planning now for the 40th trip, by God's grace. This has been really cool. Thank you so much.
It's been my pleasure.
Thank you for joining me on today's episode. Just like you would share with friends about a great book you read, don't forget to share this if you enjoyed it. Connect with us on IG and Twitter at TWWPcast and get details on the website at worldwithoutpeople.org. And hey, remember to make loving others the story of your life. Until next time, this is The World Without People.